My name is Matt Tait. I'm Head of Strategy at CQC and leading the work on the strategy and policy around CQC's oversight of integrated care systems. So I'm going to be doing a short presentation today. This is an update on our and run through our early thinking on the scoping and sort of purpose of those assessments. So the focus here is on how we look at quality in systems. So to put this in context of our work on our wider regulatory model, our strategy, which we published earlier this year, sets out how we plan to change the way we work to deliver more effective regulation in a range of different ways. There are 4 themes that sit across the strategy. And all of those will be relevant to how we develop integrated care systems, or assessment of integrated care systems. One of the really important things we're doing in the early stages of the implementation of our new strategy is introducing an updated assessment framework for making judgments about the quality of care. And that's going to not change the bar or change the way we assess quality fundamentally, but it's about distilling down the content of our assessment frameworks into something that's very accessible and importantly that applies across all of the sectors that we regulate. So currently we've got different frameworks for social care and healthcare providers. What we're trying to do is distill that into a single framework that's applicable across all the sectors and all the levels that we regulate. So that's important context because that assessment framework and the core the quality statements that are going to be contained in that framework, the concept would be that wherever possible, those frameworks, that assessment framework would also apply at the level of the integrated care systems. So there are new responsibilities for CQC that are contained in the Health and Care Bill, which is going through Parliament at the moment, and some of the important ones and what I'm going to be focused on today. Our new role in assessing local authority and assurance of local authorities, in particular how they're meeting their Care Act duties, and also the role for CQC in assessing integrated care systems. So I'll talk a bit about both of those today, but with a focus on integrated care system work. So I won't go through these in detail, but this is a sort of overall set of principles that we're working to across all of our new work, and these will apply in different ways in different parts of our work on the regulatory model. Some of these are about things that we focus on in the content of our assessment framework, so around prioritising safety, supporting improvement, the focus on leadership and culture. Those are all things that will be captured and bolstered in different ways in the work on the content of the assessment framework. People at the centre and so on. Other principles are more about the ways that we work, about being clear and consistent about how we report, about how we can be more transparent about our judgments, being clear about the proportionality and flexibility of how we work. So those principles are going to apply in our work on provider regulation, but equally again they will carry over to our work on the integrated care systems and local authorities. So this is again about the single assessment framework. And a lot of this is really already the case in our current way of working. So we already have 5 key questions: safe, effective, caring, responsive, and well led, and we've had those for about 10 years as part of our new way of working. So those will continue in provider regulation. What we're doing is changing some of the detail below that in terms of distilling the ratings characteristics and key lines for inquiry and prompt questions, which can be very long and difficult to process if you're not sort of really familiar with the detail. We're distilling that down into a single set of quality statements. But below that, we'll be collecting evidence as we currently do against those quality statements with specific evidence indicators, quality indicators, sitting underneath those categories of evidence, and all of that underpinned by best practice standards and guidance. So a lot of that is consistent with, at a high level, with how we work currently. But again, it's about making it more accessible and more transparent. So in terms of what that means for system oversight, as I said, we're developing an approach and methodology that's in line with the single assessment framework, but it'll be it's about adapting that and making sure that the way that framework works is tailored and recognises the differences between assessing an overall integrated care system across a large geographical footprint, which will contain a large number of providers and services within that, and similarly with local authorities. So we need to use the single assessment framework in a way that takes account of the differences in the roles and scale of a system level assessment versus a provider level assessment. So what that'll mean is adapting that framework, applying it wherever appropriate, and using those principles that are being developed for provider regulation, but applying it to system level regulation in a way that's proportionate and fits the context. So just to talk a little bit more about the local authority side of things. So the focus for local authority assurance is going to be around the Care Act and how local authorities are delivering their responsibilities under the Care Act. So there's a specific focus there for our assessment around that, and particularly the focus in the Care Act around an individual's journey through the system. So ensuring individuals have control of their day-to-day life, suitability of living accommodation, contribution to society. So it's about requiring local authorities to consider all of that and each person's views, wishes, feelings and beliefs in the context of delivering services. So that's something that gives you an idea of what we'll be focusing on in the context of the local authority assurance process. The integrated care system assessments will have a slightly different focus because it's not structured in the same way specifically around the Care Act duties. So I'll talk a bit more about how we're developing the approach for integrated care systems. But this is the overall sort of approach to the sort of process for assessing local authority assurance, and much of this will apply to integrated care system assessments as well. So we'll need with both of them to establish a baseline of quality and safety. This is the first time that we'll be assessing this level. So after that sort of initial baselining, it'll be about ongoing assessment of quality and risk. That will obviously be going on in the initial baselining period as well, but particularly once we've established that baseline, we'll be moving into a sort of rolling ongoing assessment of quality and risk, where we can be quite responsive and proportionate and not doing sort of big comprehensive assessments each time, but being quite flexible in how we work. There'll be a big focus on capturing good practice and encouraging improvement right across our new regulatory model. So that's something that's applicable and was a strong theme in our strategy around encouraging improvement at provider level. And again, I think one of the big things we really want to focus on and see is one of the real sort of added values that we can give in the system level assessments is about that independent view and capturing good practice, encouraging improvement from our perspective, focusing on quality as safety, integration of services. We'll of course be making use of all relevant data sources, and that means not only use of physical visits, but using the full range of evidence wherever possible. So we're not going to tie ourselves, and this was quite clear in the strategy and the engagement that we did leading up to the publication of the strategy, that under our sort of our next way of working, it's not going to be about basing our assessment and the moment that we publish a report and change ratings for provider regulation. It's not going to be about tying ourselves to a point in time where we've done a physical visit, because that's not always the most appropriate or the most necessary means of gathering evidence. There are other ways that you can gather evidence. So what we want to do is be flexible and proportionate as to how we assess providers. Again, that applies at system level as well. So physical visits, inspections will continue to have a really strong place in our ways of working, but we want to use that where it's the best means of gathering evidence. So just as the local authority assessments, the assurance process will be based around the specific duties of local authorities around the Care Act, and that'll be the focus of our assessment framework. We'll be basing the assessments of integrated care systems around the core purpose of integrated care systems, and particularly the new bodies that are being established to lead integrated care systems, the Partnership Board, the Integrated Care Board. So those bodies in the system as a whole has some specific roles and purpose around improving population health and healthcare, tackling unequal access, experience and outcomes, enhancing productivity and value for money, and supporting broader social and economic development. So quite big overarching aims, purposes of integrated care systems, and that's really what we need to focus our assessment of that level on. So it's a different sort of focus to provider regulation, where there's a specific focus on the quality of care delivered inside those organisations and in those specific services. This is a broader lens on how providers are working together and to achieve those sorts of big picture outcomes at that overall geographic level. So taking the context of what integrated care systems are trying to achieve, what we're proposing, and this is sort of initial thinking on how we might structure an assessment, is that the content of an assessment of integrated care systems might usefully be grouped around three broad themes, which are sort of linked to the roles of the integrated care systems. So one is about leadership of the system, the planning function, the strategic side of things, how well the system bodies are working together and to do that planning, to involve providers, stakeholders, members of the public, service users in the development of that strategic approach. How well do they understand the needs of their system? That sort of leadership side of things. Some of it's about the integration side of things, so how the providers and all the partners across the system are working together to deliver care. So how well pathways are working, how well the arrangements between providers are working to deliver care across that system. And the last one is around the quality and safety. So how well are actually is quality and safety being delivered to people? This is about the outcomes that people are receiving from care services. So three different lenses, three different aspects of the same thing around the quality of the system, and how well it's working together is being driven across the integrated care system. So what we're looking at is structuring an assessment framework broadly around those themes, and underneath all of those there would be quality statements drawn from the single assessment framework linked to those themes. So a different sort of structure to a provider assessment where we focus on our 5 key questions of safe, caring, effective, as I said. We don't think that structure for provider assessments would necessarily make the most sense at an integrated care system level, given the role of the system. So what we're proposing is a slightly different way of grouping the content of the assessment framework that recognises the differences at this level. So, as I said, within those broad themes, there will be specific areas of focus, content that would go under each of those themes. So this is a flavour of some of the things that we would look to focus on within that assessment framework. So service user voice at system level is a really important one. This is as much about making sure that the evidence that we gather it properly takes account of service user voice, and that we're evidencing our assessment with real experience of service users about how they're experiencing the system. So it's not just what we're being told or what the data is telling us, but we're able to triangulate that with the right sort of evidence from how people are experiencing care. There'll be a range of other sources of evidence that we'll need to gather at system level, including around inequalities, access to services. So this is a new type of assessment and a new level of assessment. We've got a lot of information of how individual providers are performing, and that will be an important part of our understanding of how well the quality, safety, integration of services is working at system level. But there'll be evidence that we need to collect across that system level that will be new evidence around those overall geographical things around inequalities, population health, all of that's a new level, but also the linkages to across providers flow within the system as a whole. So that's a bit of a flavour there. We're conscious that there will be variation among the integrated care systems. They're in early stages of development, and they're at different scales. They'll work in different ways, and one of the drivers of the integrated care system work is about local variation, about responding to local needs. So that's something we'll need to take account of as we do the work and develop the assessment approach. Important to think about within all of our ways of working in this process is about how do we have the right level of impact of our assessments and ensure that the reports, the findings that we produce from these assessments are appropriately followed up. So we won't have the same kinds of levers in an integrated care system assessment that we do at provider level necessarily. So in terms of enforcement action on an individual provider, warning notices, suspending registrations, those sorts of things would work in different ways. But important to think about the impact and follow-up of our assessments. Equally, I talked a bit about the information on provider assessment informing integrated care system assessment. So we need to make sure that relationship works properly, that the information we're getting on provider regulation does inform integrated care systems and local authority information, and equally that the information that we collect at integrated care system and local authority level properly informs provider level regulation as well, of our understanding of how providers are working. So it should be a sort of feedback loop. Provider collaboratives, that's sort of one aspect of that. One of the roles of NHS Trust is around provider collaboratives, around working together across different NHS trusts, and some trusts will have lead roles in that. Important to understand. I think that those provider collaboratives will be an important give us an important insight into how quality is working in that part of the system. So we'll need to consider that in our integrated care system assessment. But equally, they'll have a role for integrating for assessing how well those particular providers as well. So we've got some work to do to build up an approach for understanding the quality of those provider collaboratives, how well they're working, and then feeding that into the different parts of our oversight model. And finally, on that slide, important in all of this that we're avoiding duplication, that we're conscious of the different roles of the different bodies, the different regulatory bodies and other system bodies in the system, and avoiding regulatory burden. So it'll be important for us to, wherever possible, be only gathering evidence once within the system, that we're sharing information between us, and that our work is complementary to the work of other regulators and others with a role in the system, like NHS England and Improvement. And they have a specific role, and we'll need to make sure that our role is complementary to that, in the same way that our role with provider regulation in NHS trusts is complementary to people like NHS Improvement. So we've got different roles, but in the same sort of space. So if you'd like to continue the conversation on this, I would be thrilled to hear from you. You can log in and sign up to CitizenLab, which is our online participation platform, to continue the conversation and share feedback on the work that we're doing so far. So we'd be really interested to hear your thoughts and comments, particularly in terms of what are the key things that we need to consider when looking at quality in systems, and general reflections on thinking so far. As I said, this is early stages of the work. The assessments, we're working to the timeframe of beginning assessments in April 2023. So we've got sort of a bit under 18 months around 18 months to do that development work, get the systems built. So we'll be going into a period of sort of more and more engagement on the detail as we get further along. This is reasonably early days, so really important to get general early reflections on our thinking so far. Are we on the right track? Is this the right sort of focus? Do we and sort of things we need to consider when looking at quality in systems? Are we missing anything? And just any questions that people have, or things we need to be asking ourselves as we develop the work further. So look forward to hearing from you. Thanks.